because I think at least the law is a little bit broader than I thought it was. But of course, there's
Okay.
also some limitations, and those are all things that we can work on. So, if you guys want, I could kind of give you like a little primer of it.
Yes, please.
Yeah, and I'm gonna pull it up and look at it while I'm chatting if I can.
Yeah, so there's two sections in the Florida statutes. One is specific to autism spectrum coverage under insurance, and the other one is for individuals with developmental disabilities. And it's two different sections, but it says the exact same thing. It's the same thing. So, so what that means is that these requirements are not only for autism, but also for other developmental disabilities, which I think is good because that's kind of in line with like the scope of, what we wanted to be covered. So there's different definitions and things. I think that stuff you guys can look at, but there's a couple of things here. So an individual, basically what it does is it mandates insurance in the state of Florida to cover certain things for certain individuals, right? And so, like I mentioned, it applies to somebody that's been diagnosed with autism or other developmental disabilities, including Down syndrome also. And also an eligible individual means somebody under 18 years of age, or somebody who's older than 18 but is still in high school, who has been diagnosed as having the developmental disability at age 8 years or younger. So that's kind of who it's going to apply to. So already we can see that there's a limitation, because if you're above 18 years, or if you're older than 18 years but still in high school, after that, you're not going to fall within this purview. So that's one of the limitations that this has, right?
Mm-hmm.
And that's for insurance covering therapies?
Yes. Yep. If you're like 19 years old, the insurance is not required to cover you for the things that I'm going to talk about later. It's basically the main therapy. But there's states I looked at, and I sent some links on what other states have, and a lot of them look similar to what Florida has, but some of them are more comprehensive. And the more comprehensive ones, some of them don't have a limitation as to age, for example. Okay. So that we can start thinking about, okay, so this is what Florida says, but how could we make it more broad, to provide coverage to more people? So that's one of the things that we could provide for. Also, the person has to have been diagnosed before 8 years of age or younger. So that's another limitation. Health insurance plans. So, who this applies to, like which health insurance plans need to meet these requirements. There's a definition for that, and we know there's some exclusions. We talked about it before. So the exclusions are, it doesn't include health insurance plans offered in individual market, health insurance plan that's individually underwritten, or any health insurance plan provider to a small employer. So remember, we talked about the small employer limitations, and there's a few other ones here. So I kind of read up on this. I think the small employer limitation is a cost issue, because mandating that small employers have plans which cover all this would increase the premiums, and so it would be more expensive for the small companies to provide it. So I think it's kind of a cost thing. Some states do it, so it's not like we couldn't argue for this. It'll just be kind of a fight from the different lobbyists to figure out, what kinds of, how they want to argue this, I guess. I think Stacy had mentioned that there was some exclusions for like ERISA plans and things like that.
Yeah, I looked at some of that information. Did you look at that, the ERISA?
Yeah, I did, and the reason is because we're talking about the state mandating these things, and some plans are not aren't within the purview of the state. They're kind of governed by federal law. So if it's a plan that's governed by federal law, and it's kind of limited, but if there is, then the state can't come in and kind of regulate that. So that's why these things that are state mandated don't apply to those. From what I could tell. So this is another area where we could, argue to get rid of these limitations, right? It should be open to whatever health insurance plans are in the state that fall within, obviously, the state's purview. But then that would include the small employers and some of these other, like the private market ones and all of that. Let me see, what else? What does it cover? What are they supposed to cover? It covers treatments of speech therapy, occupational therapy, physical therapy, and applied behavioral analysis. So I thought this was just an ABA statute, but it's actually broader than that. So that's great. But, here I think and it also covers well baby and well child screening for diagnosing autism. Now here, I think we could maybe think about what other things do we want to make sure that have to be covered. For example, I know like assessments, I know that our insurance didn't cover any assessments with the speech therapist or the occupational therapist or whatever else. So maybe evaluations. I'm sorry?
Insurance won't cover assessments?
No, my insurance didn't cover it, and I don't see anything in the statute that specifically says assessments or evaluations for these treatments or for the diagnosis itself have to be covered.
That's limiting right there.
Right. So that's one thing that we could say, well, this should cover evaluations, assessments. I don't know. There's other states. I looked at the other states too, and it would be great if you guys could take a look through too. Some states cover other things like medications, nutritional supplements, and like other treatments, right? So maybe that's something we want to talk about. Maybe we want to include other things like feeding therapy, I don't know, group therapy, things like that also aren't required to be covered. So that's kind of food for thought.
As we're moving forward, and doing the presentation, and so, there's 6 people and we're each talking, and the more, if we have at least, we got to have some personal stories in there. So how do we want to break it up to have like, okay, so we have an opening, and this is, and then we have, 6 speaking parts, if you will, but we want to have as many personal stories as possible. So we need to kind of like figure out what of all this research that we want to mention and what's going to be, personal story and how we want to do it.
Yeah.
I think this information is good, but we don't want to overload, with some of the stuff that I found the other day on the ERISA. You don't want to overload to where your whole testimony or whatever is just like all this data and
No, I agree, but knowing how we want to change the current statute is going to frame what our arguments are, and we don't need to get into all the details. Like, we don't need to talk about why this isn't covered or that isn't covered. We just have to say right now this doesn't cover small employers, and we think this should apply to everybody in Florida, something like that. I mean, it can be something really simple without getting into the nuts and bolts of the argument and then going into the personal stories about it. Like, when we talk about that, Christian could talk about how he's a small employer. But I think we need to frame the argument and then try to see how we break it up. I don't know if it's like an introduction that talks about kind of like what the current statute covers or what it doesn't cover and then break it up. I don't know. I didn't really think about that too much at this point. I was kind of just focused on
I do. I'm trying to look at
itself.
The big picture too, and figure out, because basically what we're wanting, right, is to we want to propose, for lack of a better word, that therapies are covered under state insurance from birth to age 5.
Yeah, but what I'm saying is they already should be based on the current statute.
Right.
Yeah. So we can't argue that if that is already supposed to be happening.
If it's in the statute, then why aren't insurance
because there's these limitations, and that's what I'm trying to highlight, and I think those are the things we're going to have to argue against, because if we say if we say like what we said last time, which is exactly what I mentioned at the beginning, that when I read this, I was like, we're going to have to change our argument a little bit, because we said we want all therapies to be covered for all individuals, right?
Right.
So this already applies to autism and other developmental disabilities. And this already talks about ABA therapy, speech therapy, occupational, physical therapy, like all the main therapies, the 4 main therapies.
Okay. So our primary problem is some people can access it, but others cannot. Is that basically what it boils down to? That if you have state insurance, you can have all those therapies. But if you are unfortunate enough to work for a small employer or not have the right insurance, you cannot.
Right.
I'm sorry, I'm just trying to make sure I understand our argument clearly.
I don't know.
So let me just talk about the other 2 things, and then we can talk about what we want to do with this, or at least try to frame it. But the other limitation is that it's 36,000 annually, and it cannot exceed 200,000 in lifetime benefits. So they don't have,
Deanna, would you mind repeating that first part? It just didn't come through.
Sure. There's a limitation so that the insurance doesn't have to cover services past $36,000 annually and $200,000 in lifetime benefits. So if it's somebody that requires more and the insurance is already covered 36 in a year, they're not required to cover more than that. If the person has been receiving therapy since they were 2 and somehow they've received 200,000 in therapies that the insurance is covered, they're not required to cover anymore.
Oh, so is the intent that they send the individuals to the state for that help?
I'm not sure. I think this was just to limit the liability of the insurance company, so it wasn't totally unlimited. But I know there's states that don't have these type of limits.
Okay. Do you know, it's like California perhaps, or?
Hold on. I sent a link around. It has all the states. California, I think, doesn't have limits. I know Massachusetts doesn't have any limits like this. So if we need to provide examples, I guess we could do that.
Okay. No, I was just curious. I mean, we can.
Yeah, California. I thought I read somewhere that it didn't, but I'd have to look through again all the different state requirements. But I know there's states that don't. So that would be a shortfalling of the Florida statute, right?
Yes.
And then the other thing that I noticed was that that obviously all of these things, like the coverage is subject to other exclusions and limitations of the policy and the plan, et cetera, et cetera, et cetera. And I think, this is kind of basically, this is where the insurance companies can kind of not cover certain things, because it's part of like whatever the specific plans require. So I don't know with this one. I really don't know. I think we need to do more research to see what if anything there is to do about that, because I don't know if you can just blanket say you need to cover everything, period, right?
Right.
But anyway, so those are the kind of things, those are the issues I saw with the statute and things that we can talk about to broaden it. Because as it is right now, the statute already requires some plans to cover all therapies, occupational, physical, speech, and ABA for autism and for other developmental disabilities. What are the shortfallings? The shortfallings are the limitations on annual and lifetime coverage, the limitations on the age limitations, and the exclusions they have for the small employers and some of the other like individual market plans and things like that.
Okay.
Okay.
So I don't know, Dina.
Yeah. Yes.
Yeah, I don't know if you want to talk about now how we can try and frame this.
Well,
organize.
I don't know, because I was playing around. Okay, so what I did the other day, and I don't know, I emailed some stuff out, and then I don't know if I emailed my other part out, which I can do. I looked at, I was looking at the ERISA, all that stuff, and it's like big lawyer talk, and I was getting confused. And then I looked at the that Lovaas study, and I can send that too. And I started just kind of composing like an open, in the beginning kind of thing. But a lot of the stuff that I looked at was talked about, like the first couple years of life, and, the focus on the urgent and substantial need, and where the American Pediatric Association, says, early intervention is key, and then in the long run it'd save money. So that's kind of what I was looking up and finding that out. So somehow we need to, if we want to kind of, but then again, if some therapies are covered, I still think you want to back it up and say, it is necessary, it's, cost effective in the long run. And I guess we need to go, instead of the focus being, that it needs to be covered, it just needs to be, I don't know, like all covered.
I think it needs to be covered for everyone.
Right. Covered for everyone.
So maybe like, we probably still want to talk about early intervention, but, one of the limitations of the Florida statute is that it only covers up to 18 years of age. So maybe if the person requires it.
So we can talk about the age limits and the stuff like that. So, and I'm just thinking, from what I had, like, and I guess I'm thinking, I don't really have a personal story. So maybe I would do like either the opening or the closing, because I don't, like I said, I don't really have anything to share, personal, whatever. But so you could, when you frame it and talk about, how somehow it's, even though it is covered, it needs to be covered for all, and this is why. And then, we have a part that talks about, the information you got. But then again, how do we need to come back at the end, and we need to have a solution. Remember, she said you have to have a solution to what you're presenting.
Yeah, the solution is to get rid of the limitations.
Okay, I have a personal story, but I didn't have any of the coverages we're talking about. Everything was just done from the family pocket. So, but I can still use a personal story to tell the success of the early intervention, how we started at 3 years and how far we've gone, and the progress was
No, and I think that's a good point. I think that there needs to be at least 2 or 3 of stories without data, almost like, this is what we did. It worked for us. We need it, that kind of thing. And only hit like in the opening and the closing, maybe, of the data and this and that, because Stacey was saying that, what's going to get them is how it's affecting the personal stories and stuff like that. But then again, you do have to bring it home and say, and this is what we're proposing. This is our solution.
Yeah, I'm actually looking for photographs on the first day of my child early intervention years in school. I want to bring it up. I want to bring them some mid-progress photographs, and I want to bring like where we are today. So I think these stages will help to tell 1,000 stories, even just with less words,
Ebele, I have a question.
Yes.
Does your son still receive some of these therapies?
He doesn't receive therapy. He just gets some accommodation.
He doesn't receive. Okay. So
he just gets some accommodation. The therapy starts at age 5, but he gets some accommodation on his IEP.
Yeah. No, but that's good because, like Dina said, I think that story is important because one of the arguments for all of this is that for some kids, right, not for everybody, but for some kids, the early intervention or providing these therapies when early on will save more money later on because the thought is that they will be able to function better, after having had all this intervention. So I think your example is a perfect example of a situation where the child received all the therapies they needed early on, and then later on he was able to wean himself off of that. That's not going to be everybody's situation, but that's but that's one of the main arguments, that no matter what level of the disability, they'll still be better off with all these interventions later on than without them. Yeah.
Yes, exactly. And it's going to make them more independent and less burden to the family and to the community and the society at large.
Mm-hmm. Well, and what you're saying about is that's kind of and I'll email it out later, that 1985 study that she was talking about. I downloaded the PDF of that, and part of what he was saying was that, if you do the early intervention and all this stuff, that students may not need it later, or they may, it may help them to where they don't need it. So that's, that could be a story, and then there could
that's my story.
There could be a story of
honestly, without the early intervention, I have no clue where I would have been today. I believe the early intervention was one of the major things that he was able to, progress the way he did from the age he got intervention at 3 years until 6 years when he got up the intervention.
Now, for Stacy or Dina, do you guys, because your kids are older, do they still require some of these therapies?
Yes.
Yeah.
We have 10 minutes left, and I think will switch me over to a system I have to start charging for.
To the paid. Okay. All right.
One thing that concerns me is that over the years we've had, because Riley took so much, we weren't able to always be working, and we actually moved states. So insurance got very, very messy. And then my husband worked for a company that didn't have insurance at all, for a tiny insurance company.
Right.
That was problems. We got state insurance, and they would suddenly, a couple times over Riley's lifetime, drop him. That Riley is very complicated. So is our OT and PT. And then we also, CMS, Children's Medical Services, was funding something we were very fortunate to have, is a pediatric arm of Hope Hospice, our local hospice program, that provided things like a nurse to help me organize all of his care. We got massage therapy for a while. We got music therapy. I was very fortunate. And then, without warning, at least twice, we were totally dropped. And suddenly I had no access to diapers, no access to PT and OT. And I don't mind taking a break from these things, but I was scared, and I had no access to doctors all of a sudden. It was just yesterday at healthcare, and today don't dare go because everything out of pocket, what that's going to run you. I think that we need to frame something in there that it isn't appropriate for Medicaid to suddenly be dropping. And in all likelihood, it had something to do with our income, because the levels they set are pretty low. That obviously you have enough money, and here you are barely making ends meet, especially if you have a complicated kid and only one of you is working. So that sudden disappearing of your medical and therapy. So also, I'm not talking just OT and PT, but I lost the primary care, the PCP, neurosurgeon, neurologist, orthopedist. They were just all gone to me all at once, unless I wanted to start racking up more credit card debt. So that concerns me quite a bit.
Yeah, I have to see how Florida Medicaid plays into this whole thing.
Right. And I'm desperate. So I would go, it's like I made every call I could, and it was just like, you're out for at least a month. And when you have a kid, you don't know who's going to end up being hospitalized. That's a problem. So I went to everyone. I went to my representatives. I dragged my kid in there. And then finally, last ditch effort, I emailed the governor. And that office sent the right person to me. And within 24 hours, he had his insurance back. Great for me, but should we all be having to call emergency to our governors to have our insurance reinstated?
Well, I think that's the overarching argument.
Mm-hmm.
That, some people don't have coverage or have insufficient coverage through the state, and so we have to rely on our private insurance. But then the private insurance in many cases is also does not respond because of all these limitations or whatever else. And then you're left with no options but to pay for these humongous costs on your own.
And debt.
Get into debt, basically go bankrupt just to keep your child, with all the therapies they require. So, so I think we could somehow weave that argument in. I'll take a look and see if this applies to like the Medicaid programs and stuff too, the state provided programs, but I would imagine that it would have to. But some of the things you mentioned about some of the therapies that he received, it would be interesting to see if we could include those in here. But in terms of getting organized, I don't know, like what do you suggest, Dina? You want us to think about how to best organize the argument and send some proposals and see what people agree with?
What I could do is I'd be willing to kind of send what I started with like holes in it and, comments here about inputting it just for something to start with and see. Obviously, we're going to change the focus, right, to just instead of from the, birth to 5 for all, regardless of, do we want to take out limitations or do we know yet what our full focus is going to be?
I mean, if you want, based on the statute, based on the research, I can send you what I think the proposal needs to be, because it doesn't make sense to make the argument we had before, because that's already supposed to be happening.
Right.
So,
right.
So I could send like a proposal, but also like if anybody has any input on it based on comments, it'd be great to get
that would be good. We can kind of have like a working document and people can add back and forth and, because I know. So Stacy, were you gonna talk about your story when you speak?
I think we just see what we have and what makes the most sense when we get a little closer. Because I don't have to get it out there, but if it works with how our argument goes, I'm fine with it.
Okay.
Stacy, can I ask you a question?
Sure.
Is your son's disability considered a developmental disability?
That's really hard to say. He falls into developmental now, but his original issue is simply that he had a massive brain hemorrhage.
Right. Yeah. So I'm just thinking because, since we may be arguing that providing these therapies through insurance through 18 years, which is what the statute says, like some people will require this lifelong, right? Like your son, you said so maybe your story is applicable to that part of the argument, but I'm just trying to figure out if he fits within the actual definition, which I think maybe he does. But anyway, I can send what I think needs to be the argument based on where we are with the statute or like a proposal on what I think we could argue, and then you guys can tell me if you agree or not. And I can give some further thought, Dina, into how do we organize and maybe who could do what, and then how do we organize the argument in general, and everybody else can
putting all the pieces together.
And maybe we can start there, because we'll have to start like honing down on all that soon, I think.
Right. Yeah. And then maybe, you know, after were we going to try to do another phone thing before we met in December, or just work kind of on our stuff and then like talk about it in person?
With Thanksgiving, I'm a little worried we're not going to manage to pull it off. How about?
Yeah.
Well, which is fine. I'm just wondering. So this week's kind of out for people, and then you know, we meet the second week in December, and then when we meet again in January, we're we're on. So
yeah, maybe
if we all have info, then maybe we can just like all, you know,
your first week in December. I mean, let's the possibility of having a phone meeting first week in December before we come in, you know, so that we'll be like concluding most of the things we have on that day when we sit face to face.
Yeah, but at least if we have all the info, we can kind of, you know, hash out some other stuff. So.
Yes, and the good thing is that we're going to have some time to work on our project while there. So, I mean, 2-3 hours of concerted effort is going to help.
Yeah, I don't necessarily think we need to talk, but we definitely, I think, need to keep the lines of communication open and start sending, circulating things and ideas so that we're somewhat organized when we get to the meeting, and so that people, like, I already started putting together like a personal statement, just it's like a dump of things I want to talk about, and then as we see how it fits in or where I'm going to fit in, then I could always go modifying that, you know?
Right. Well, it's always better to have more than you can talk about, you know, because we're going to have to, Right.
Yeah, I agree. So that's kind of what I'm doing. Everybody else could kind of do the same, and then we'll see, you know, in the next couple of weeks, sort of where everything fits in. And
sure. Well, if you want to send me the argument that you're proposing, then I'll kind of work in with what I have. And if I, you know, can't get it emailed out before Thanksgiving, then I'll do it, you know, right after.
Okay. So over the next couple of days, I'm gonna circulate the proposal for the argument, right? And you guys provide input, please, and then I'll send maybe like how we may be able to organize based on what people have said they may want to address with maybe some options, and then you guys can also provide feedback. That's just a proposal, of course. You know, everybody else
that sounds good.
Okay, and then I'll send you once I started working on it this weekend, but I want to refine a little bit more. I'll send you whatever I have, and we can start looking at it too.
Thank you, ladies.
Thank you.
All right.
I recorded this,
all right,
but I'll have to figure out how I should even share it, because this is being the host is new to me. I've attended before. So thank you, everybody, for signing on. I know it was tough.
Thanks,
all right,
guys.
We'll talk soon. All right.
Happy Thanksgiving.
Bye.
Thanks, everybody. Bye.